I'm Stone Manges alongside Brady Donovan and senior nursing major Aubrey Burns. Aubrey's going to give us a tour of the entire nursing department and the all-new immersion room here on the first floor of Stewart Hall. Don't go anywhere, you're watching The Buzz.
Welcome to the nursing department. Follow me. We're on the second floor of Stewart right now. This is where a lot of our nursing classes take place, and if you look on the walls, you get to see everybody that came before us. If you come into this room, this is our nursing lounge. This is where we like to hang out, study. They have coffee for us, snacks if we need, and some inspiration, different bulletins. And if you look in that corner, those are our scrubs. We can donate them when we're done with them, and we often give them to freshmen whenever they come in. This is another little lounge where we can hang out and study. We also like to discuss different plans, projects, and things that we do in lab, which is right downstairs. Now we're on the first floor of Stewart, which is where all of our labs are. We have the normal sim lab, the immersion room, and our AI mannequin. This is our normal sim lab where we practice running codes, practice new skills like NG tubes, IVs, Foley's, really anything you could think of we're able to do here on the mannequins.
How many of these mannequins do you guys have?
We have 8 mannequins. We have a special one whose name is Leo, who does some extra things, and then we also have Alex and the immersion room. So there's many opportunities to practice your skills. This is our birthing simulator mannequin. So she can simulate giving birth and being pregnant, and we can do assessments on her and her baby.
Love to.
Support the neck.
Brady is a proud father.
Absolutely. I'm
proud
the newest
father.
member of the nursing department.
Aw, yay Brady, yay Brady. He's a father, yay.
Sorry. These are our IV arms where we can practice inserting IVs. They have blood and they show all the veins, and it's a really nice way to practice your IV insertion.
I'm sure it's a lot easier than doing IV practice on a real person.
It certainly is. The arms don't scream or move, and the veins are much more prominent.
I know I hate needles, so yeah, no thank you. No thank you. Never do this. Never be a nursing room.
We also have arms to practice listening to blood pressures on and taking them. So they are programmed on an iPad, and you can set it to whatever blood pressure it is, and you can listen. And if you get it right, good for you, you're good at taking a blood pressure. So this is our AI mannequin. His name is Alex. Hi, Alex.
Hi.
He talks, breathes, he remembers information you tell him, and you can have a full conversation with him. Try it.
Okay.
What's up, Alex?
I'm doing well. Thanks for asking.
Are you having a good day?
Yes, I am having a good day.
That's awesome, dude.
That is- How are you feeling, Alex?
I feel good. Thanks for asking.
That's pretty.
That is awesome. That's awesome.
So how in depth does this really get, Alex?
So Alex will answer any question. We can program him to different things. We can say what his job is, and he'll remember that and tell us all about it. Or if we don't really say those things, AI will step in and make them up. So ask him any question you want.
Do you think he knows about the Steelers? Ask him. How many Super Bowls do the Steelers have, Alex?
I'm not sure. I don't follow football.
No! He's not a Steelers fan, dude. No.
Alex, what's your favorite sport?
I love basketball.
Alex is a Lady Jays fan.
Sure.
That makes sense.
So we can do anything on Alex. We can listen to him breathe, we can listen to his heartbeat. The difference is with Alex, he answers us, as you can see. With any programming, he can tell us if he's in pain. We can tell us if he came to the hospital for chest pain. We can program him to do whatever we want, and he'll do it.
That's very interesting. That's cool. That's really cool.
It sure is.
Thank you, Alex.
Bye, Alex.
Yeah,
He's off.
I still say bye. I'm about to say bye to my friend. Even though he doesn't like the Steelers.
If you don't say bye, he'll come and haunt you in your room. Not confirmed, but he might. And finally, our newest addition to the nursing department is our brand new immersion room. And here it is.
Wow, this is something.
Thank you, Aubrey, for taking us on a tour around the nursing department. I had no idea that.
I'm glad you
I've never
guys
been
came
to
along.
Stewart, so.
Yeah, that's awesome. That's awesome. Thank you. All right, I'm here with Dr. Zach here in the new immersive room in the first floor of Stewart Hall, and Dr. Zach is going to answer some questions for us today. Doctor, what are some of the positive effects that we're already seeing from this immersive room on the students at Waynesburg?
That's an excellent question. So some of the positive effects are the students are excited to come into the simulation lab, which sometimes it can be a little bit scary, but this kind of takes away the element of fear. So the students are actively engaging with one another and the faculty with the mannequin, and so it creates an atmosphere where students are more apt to ask questions and interact with one another.
Have they been able to try out the room?
They have. I would expect that it's completely up and running and functional in every simulation class by fall, but we are trying to get all of our students in here and using it, including our seniors, which are probably a little jealous.
So NASCO Healthcare was the company that was heavily involved in installing this room. What was it like working with them and having it installed?
It was an easy task getting it installed. So we actually worked with McKesson, and then they worked with NASCO. NASCO came in to put in all of the technology, and they had it up and running 3 days. So actually the person that created the whole system came here to install it.
So how does the immersion room compare to the way that you would traditionally teach medicine?
So the immersion room allows us to do hands-on. Students can use all of their different skills, so tactile, auditory, all of those skills. I would say the way that it has really helped is that we can, in real time, create a scenario. We can see how the student reacts to that scenario, and then they can judge whether or not they need to improve.
What's it like having this, one-of-a-kind technology that not many places around the world have right here in Greene County?
So it's pretty amazing because we are the first place, the first university to have this in the United States. So nobody else has this. Now, some people have it in Dubai and in Africa, but we're the first to have this. So we're extremely blessed that we have donors that have looked at the nursing department and decided that our students need this technology to help grow, to be great nurses. We're excited. We just want to play with it every day.
How about that? A one-of-a-kind technology limited to only a few places in the world, right here at Waynesburg University, the first floor of Stewart Hall. Dr. Zach, we appreciate it. Thank you.
Yeah, thank you.
Hello everybody and welcome back to the Buzz episode with the nursing department. Stone, Manges, Aubrey Burns, Brady, Donovan here. We are doing a little medical myth or fact. So Aubrey has prepared a few questions for us and we're going to jump straight into it.
Okay, first, myth or fact? We only use 10% of our brain.
I feel like so do
Is it
I.
10%?
I feel like I've seen this on like TikTok.
I don't know if it's 10% or not.
I don't know.
I feel like we use more than that.
So I'm going to go with myth. I don't know.
Yeah, let's go with myth.
You are correct, it's a myth. So this idea arose around 1907 when people were advocating for power and self and like self-improvement. So that was really just a way to get you to think you could dive deeper into your brain and better yourself.
How much of our brains do we actually use?
All of it.
All of it. Oh, wow. Okay. That's
Different
a lot
uses
more,
for different
it's
parts.
a lot more than
but
10%. So we
Yeah.
were.
Yeah. Hair and fingernails grow after death.
I feel like that's a fact. I feel like
This is true. Is it true?
is it a fact?
It's a myth.
Oh, no.
So the science behind it is that whenever you die, you dehydrate and your skin around your fingernails would retract. So it makes it look like your nails are longer, but really your nails are just the same length. Like fingerprints, each person has a different, unique tongue print.
Stick out your tongue.
Tongue print. Tongue.
I don't know if I've ever heard of it. I'm gonna say it's
a fact. Just to be different.
That one is a fact.
Oh, wow.
Everyone's tongue is unique. Every makeup of tongue is different. Like you said, you might have a burn. You might not have the same number of taste buds. So it's a fact.
tongue.
Never heard of it.
Serious. Stick out your tongue. Let me see.
No.
Okay. Next question. Salads are always a healthy choice.
I'm gonna say no, because like, what if
Yeah.
you drench that thing in ranch dressing and it's not so healthy anymore?
Yeah, I'm gonna say
Yeah, you guys are right. That's a myth. High-fat dressings, bacon, cheese, anything that makes a salad good makes it probably unhealthy. So a good salad would be lettuce, cucumbers, mostly your vegetables there.
So you're saying like a Pittsburgh salad with all the fries on it isn't healthy?
We'll say it's good for the soul.
Exactly. That's all. That's all I
That's a
need.
good use of terminology.
On average, Americans eat half a cup of sugar a day. Imagine half a cup.
Half a cup. That's a lot of sugar. That's a lot
That's
of
a
sugar.
lot. We ate a lot of sugar. the
Yeah,
other
we
day.
did. I'm gonna say it's a fact. Just because I know
Half
everything
a cup
out
is
there.
a lot.
Yeah, but everything out there is sugar.
I'm gonna say it's a myth.
Brady?
I think it has to be.
It's a fact.
Oh God.
Americans eat a lot more sugar than they should. Women are recommended to eat 100 calories worth of sugar, men no more than 150. So next time you dive into those Reese's cups, keep that in mind. Yeah. Cold weather makes you sick. Myth or fact?
I'm gonna say myth. I think you might be more prone to get sick, but I don't think it gets you sick.
I'm gonna say fact. I disagree. I'm gonna say it's a fact.
This one's a myth.
No.
I'm
The
the
cold
greatest.
weather
I should be a
isn't-
nursing student.
Isn't what makes you sick. It's being around people that are sick and them having viruses or bacteria. So really it's more so about who you're around than the temperature outside. Eating too much carrots will turn you orange.
What do you think?
I think that's a fact. But I don't know. I know it gives you better eyesight, but I don't know if it'll turn you on.
I think it's.
I'll go with you.
I think it's a fact. What is it?
It's a fact. It's very rare, but it is a fact. So carrots have a pigment, it's called beta carotene, and if you eat so much of it, it can give your skin an orange hue.
How many?
It depends on how big you are and how
Okay.
much skin you have. It has to be an exceedingly large number of carrots though.
So hypothetically, would you die before you turned orange or no?
No, you can turn orange.
My parents said I turned orange when I was a baby. I ate too many carrots. It's true. That's what my mom says. Shout out, Mom.
Okay, myth or fact? You're taller in the mornings.
I'm gonna say myth.
I'm going to say myth also. 'Cause I feel like the reason you stretch.
This one's a fact.
What?
Yes, you are approximately 8 millimeters taller in the morning than you are at night because whenever you're standing up all day, your back has cartilage in between your spine and it compresses and you become shorter. But at night, you can stretch out.
So I'm close to six feet
No,
tall.
not even.
Sleeping,
Not
right?
even.
It's a very small amount.
Not even. She said 8 millimeters, not 8.
In my dreams, I'll be 6 feet.
A quarter of your bones are in your feet.
Quarter.
I know there's a lot of bones in your feet, but let's just do the math. That's almost 50.
Myth. I'm gonna say myth.
I'm going to say
It is a fact.
Jeez.
Each foot has 26 bones, so 26 times your 2 feet is 52, and that's exactly a quarter of your 206 bones. Cracking your knuckles gives you arthritis.
This one's a myth.
I think that's a
I
myth,
know this
too.
is a myth. Because my dad, he tells me when I crack my knuckles, you're gonna get arthritis. I think it's a myth.
So you don't believe your dad?
No.
I think it's a myth.
You're right, it's a myth. The sound you hear is just gas bubbles popping, and it has nothing to do with getting arthritis.
Take that, Dad. No. Think maybe. Oh. I used to hate cracking my knuckles, but then my brother, he told me that it was a good idea too.
And that's all I have for you guys.
That's it? Okay.
Yeah.
Well, thank you to Aubrey. Appreciate it.
welcome.
And thanks for coming on, Aubrey.
Thanks for having me. Thanks for seeing the nursing department.
This was really cool. Thank you to Dr. Sherry Zach. Thank you to Aubrey. Shout out to all of the nursing patients and teachers and doctors. And shout out to Waynesburg University for putting in the immersion room. I think that's really cool that, one of the only places in the entire world that has that technology. I think that's really cool, and it's right here at Waynesburg University in Greene County. Well, thank you again to everybody involved. You're watching The Buzz. Make sure you stay tuned on the WCTV YouTube page for more content, and thanks for watching.